When he shows up, we'll join him into the mix. Welcome, everyone. We have a special session today, panel session on challenges, insights, and trends in the industry. And we're very fortunate to be joined so far. Looks like we have someone coming in. Hello, welcome. By Dr. Devanzo and Dr. Kelly, who are going to share some of their insights and experiences working in academic publishing. But before we get started, we wanted to give our panelists an idea of who they're speaking to today. So if we could just very briefly, fellows, go around and introduce ourselves. And in fact, I believe that Dr. Carpenter and Sabath, we should do the same since we've not had a chance perhaps to meet Patrick just yet. So just very quickly, my name is Dr. Lecomte. I'm co-CEO of BCPH and co-editor-in-chief of the Boston Congress of Public Health Review. And welcome again. And I'll hand it off to my colleague, who is to my left on my screen.
Absolutely. Thank you so much. Nice to meet you, Patrick. I know everyone else. So the other CEO and Chief Strategy Officer for BCPH. Pleasure to meet you.
Likewise, happy to be here.
Yeah.
All right, thanks, Patrick. Thanks, Paul, for joining. I'm Sabath, the director for the fellowship. So I've been communicating with you both to make this happen as well. So that's much about me. I'm sure you would have heard about me from Candice and Cersei. So currently I'm based in Nigeria, right now in Abuja, because I move around a little bit. So right now in Nigeria, and I'm majorly into public health program implementation here in Africa. It's nice to meet you all. So I'll pass it back to Cersei.
Yes, yes. And so I think now we'll have the fellows go around, just do a quick round robin introduction, and then we'll hear from our panelists. And so we'll start with Yasmin. And once you're done, if you could popcorn it over to the next person.
Hi, my name is Yasmin. I am actually a public health informatics intern here at BCPH. So I'm just going to be here observing and learning, and I'm very excited to be here with you all today. I'll popcorn it to Sophia.
Hi everyone, my name is Sophia. I'm a recent graduate from Northeastern where I got my Bachelor of Arts in Public Health. And now I'm a research assistant at a healthcare nonprofit called the Institute for Clinical and Economic Review in Boston, Massachusetts. And I'll popcorn it over to Dr. Jamie Means.
Thank you. Good afternoon. I am Dr. Jamie Means. Of course, a fellow here, background in public health, started with my master's in public health from Meharry Medical College. And so with that, I will popcorn it over to Mohammed.
Hello, I'm Dr. Mohammad Khalid and clinician by profession and special interest in pediatric infectious diseases and working with Pakistan Infectious Diseases Journal. And I will popcorn to say.
Oh, Dr. Sadie, you're on mute. I'm so sorry.
Okay. Good evening, everybody. I'm Dr. Sade Abdallah, based in Kenya, public health MD specialist, affiliated with Kenya Association of Muslim Medical Professionals, where I'm hoping to apply my skills in their effort to establish a journal on Muslims' health, all right, in Kenya.
Who should go next?
I'm going to popcorn it to Marco.
Hi, everyone. I'm Dr. Briano. He, him, pronouns go by Dr. B, associate professor here at University of Southern California. And yeah, I'll leave it at that. So let me popcorn it to my colleague, Obina.
Yeah, thank you. Hi, everyone. My name is Obinayatong Princewell. I have a background in eye health and as well as masters in public health. Currently doing my PhD in the University of North Texas. That's a little bit about me. I'll pass it on to Becky. Thank you.
Hi, I'm Becky. I'm resident in Cameroon. I'm a pharmacist and I work with public health supply chains, an emerging public health reviewer thanks to the BCPH, this fellowship. I'm glad to be here and to listen to the panelists.
And who should go next?
I can go
I couldn't
next.
hear. I could. Okay, great, great.
Hi, I am Mariah Cedar. I hold a doctorate in public health from Tulane University. I'm also an assistant professor of One Health at the University of Alaska Fairbanks, and I'm based in Anchorage, Alaska. Nice to meet you.
Sure.
Sorry, who hasn't? Jaya, have you gone?
Yeah. Hello. Hello, I am Jaya from India. I am working as a professor at Ukata Sadia University. I'm heading a nursing institute and we have students and I work for the college and as well as for the students and I keep reviewing some papers as I get time. Thank you. I pass it on to Marisha.
Hi, everyone. Great to be here. I am Marisha, she, they, pronouns are she, they, and based out of Sacramento, California. I am an applied practitioner in the government and public sector, so I'll just keep it at that and then popcorn it to, who hasn't gone yet? Manaswini, I'll just popcorn it to you.
Hi everyone, I'm Manas Vinir Manas. I'm based in Stockholm, Sweden. I have a master's in public health sciences, and I'm currently working at the European Centre for Disease Prevention and Control, working on issues of scientific quality. Very happy to meet everyone. I will popcorn it over to Enyonam.
Hi everyone, my name is Enyona Machaniku. I'm currently my last semester of Masters in Public Health at Western Illinois University, Macomb, Illinois. I'm happy to meet everyone. I love research and then I like to be here and learn more. Yeah, I'm glad for this opportunity from BCPHR. Yeah, thank you and nice to meet everyone. I think everyone has spoken. Okay, so I'll call Dr. Samia.
Thank you. Hi, everyone. I'm Samia Hussein. I have my master's in public health from University of Connecticut and a doctorate of public health from Mercer University in Atlanta. I currently serve as a director for the Office of Multicultural Health Equity for the Connecticut Department of Mental Health and Addiction Services. Nice to meet you all. And I think, let's see, who hasn't gone yet? Sophia.
I think I already went, but
Oh, you did. Okay,
yeah,
sorry.
that's
This is the hard part where we're trying to
I think
figure out
everyone
who's
has gone.
gone.
I think everyone is gone.
Okay,
I think
great.
everyone is gone. So with that, would love to hear from our panelists, just a brief introduction. And with that, maybe start with you, Dr. Kelly.
Yeah, hi everyone. It's great to be here. So I'm actually a PhD candidate finishing up my dissertation at the Brown School of Public Health and Behavioral and Social Health Sciences. So my research really focuses on medical decision making. I use qualitative methods and computational techniques to think about things like sexual health and substance use and harm reduction. My dissertations uh, using, electronic health records for our health system in Rhode Island to create a supervised machine learning model that could predict exposure to something called xylazine in the drug supply. In terms of my editorial experience, I'm currently the student editor of the American Journal of Public Health, and then next month I'm transitioning into a new role as managing editor of education innovation for the journal. So just kind of briefly, what a lot of my role focuses on is soliciting our policy and practice editorials for most of our accepted research papers and analytic essays. I'm also a co-editor of our forthcoming feature section that's looking at responsible use of AI in public health. And then in the expanded role, starting next month, kind of taking um, it's an exciting time for the journal. We're under new leadership, and so we're investing a lot in actually student engagement. And so thinking about bringing on new student editors and continuing to grow the pipeline of talent at the journal. So it's awesome to be here to chat with you all.
Fabulous. Thank you. And then we'll go to Paul and then Gabriel.
Got to unmute. Hi, all. First of all, thank you so much for the introduction. My name is Paul Davanzo. My pronouns are he, him. I'm currently an assistant professor at Rutgers School of Public Health. I received my PhD in social and behavioral health sciences from Temple University's College of Public Health. And then I completed a T32 postdoctoral fellowship in behavioral sciences and HIV prevention at Columbia University. My editorial experience, I don't have as much editorial experience as Pat. My editorial experience has mostly been as an ad hoc reviewer for a number of journals. I'm also a senior associate editor for the journal Annals of LGBTQ Public and Population Health. A lot of my work has been in that area. As you'd assume, I do a lot of work related to HIV and infectious disease, but more from a behavioral health and social epidemiology standpoint. And I'm also on the board of BCPH. And so I'm really excited to talk with you all and try to answer whatever questions you might have about the editorial process.
Yes. And then Gabriel, how are you?
Thank you. Thank you very much. My name is Gabriel. I'm Nigerian. I am a laboratory scientist by undergrad degree. And I have my master's in global health with specialty in healthcare management from the University of Global Health Equity in Rwanda. And I did my MBA in UK. Then I'm currently doing a master's in medical leadership as well. So my work has been in research. So I have like quite a number of publications in terms of peer review publications. But I try to balance that with storytelling as well. So I think that's where I get to express myself better because, when you work in research, you have those structured way things should be. But when you're doing storytelling journalism, you get to be more expressive. So I get to experience that as well when I worked with Nigeria to watch for about 2 years. So I have a lot of stories. So if you want to read a lot about Nigeria and things happening in Africa, you can just check out Nigeria to watch. So I work there. So I tried to balance my technical, writing skill there. Did some work with marginalized communities in Rwanda while I was there. Did some work around population net as well. And yeah, currently working in the space of learning disability. So in the UK, I work with an organization called Latch, which is global as well. So they have branches across the world. So I write as well, basically just helping with communications, internal, external communications. And yeah, on the side, I lead a team as well, trying to see how we can build electronic medical record for hospitals in Africa, those resource limited settings. So how can we help them move from paper to electronic medical record and even medical outreaches as well? How can we make sure that they are using a very good system and not just using paper that can just get missing? So so I have lots moving around. So thank you.
Great. Well, thank you for those nice introductions. And so that brings us to just our questions for today for you all collectively as a panel. And you kind of covered this in your introductions already, but I'm going to ask it again to see if there was anything you had wanted to add. And it really concerns like the types of journals for which you've served as on the editorial board or as a reviewer. I didn't know if all of those were in the public health arena, And if they were outside of the health arena, like what were the differences in the experiences you've had? How were they similar? And also, like, why did you choose the journals that you have chosen to work with? What drew you to them? So, Patrick, I didn't know if we could start off with you and we'll just keep doing our little round robin here.
Sure, absolutely. So, I primarily review for journals in the LGBTQ health space and the substance use space. And then, as part of my master's degree, I did some work in the sort of aesthetic surgery space. And so sometimes cosmetic or surgical focused journals, kind of one-offs. And I would say through those, just through continuing to review and to be someone who tries to write kind of thorough reviews, I was invited to be on editorial review boards, which is really, there's kind of a difference in being like an editorial board reviewer, where you're kind of someone that's in a trusted pool that the editorial board can count on to maybe review 5 or 7 times a year versus actually being on the editor's team. And so there's two journals that I'm on that kind of review board for, which is the Journal of Medicine Access and then the Behavioral Medicine. And so then with the American Journal of Public Health, I'm considered to be in the editor's team. And so what drew me to AJPH was the fact that I was really looking for rigorous training in the editorial side of the publishing enterprise. And the student editor role really provides that level of mentorship to kind of essentially train you in how to be an editor for AJPH. And I was especially interested in AJPH given its, global reputation, but then it's also a really great journal because we get work from all over the world, from all different content expertise. And so I'm exposed to a lot of different literature, especially through soliciting the policy and practice editorials. A lot of the work isn't necessarily in sexual health and substance use. And so it's a great way to form connections as well. So.
Thank you for that. And I'm putting in the chat just a link to AJPH in case folks weren't as familiar with it. But I appreciate your discussion around like the subject areas you're focused on. And thinking of that, going to my left, we have Dr. Devanzo, and I was wondering if you could share a little bit about your experiences working with different journals, both in and outside the public health space, how you chose them, and how the experiences differed or been the same across them.
Yeah, very similar to what Pat said. So my work has mostly been in the areas of sexual and gender minority health, HIV, infectious disease. Those are all sort of typical public health journals. But I think increasingly, given the need to how my work has sort of evolved, I've become it's happening more frequently where I'm asked to review papers that are a little bit more traditional biomedical science focused. And a lot of that comes from the work that I've done related to adherence interventions for people on HIV treatment. So they have a slightly more of pharmacotherapy bend to them. So evaluating different methods to measure concentrations of different ART regimens for people who are on therapy. But I would say the majority of the journals that I review for are either population focused, so transgender health, men's health, LGBT health, or sort of area focused, so STIs, HIV, infectious disease. And to answer your other question, Cersei, about how, I think this is probably the most common way that people get involved or become sort of frequent reviewers for a particular journal. At least this is how it happened with me. It's journals that I've started submitting to regularly. You get put in their pool. So when I look at the journals that I review for most regularly, they're also the journals that I'm submitting to most frequently. AIDS and Behavior, STD, which is the journal that's run by the American Sexually Transmitted Disease Association. There are others that I'm just probably blanking on. But in terms of like, that also is, I see that as an incentive to continue accepting their invitations as well. There's no one-to-one correspondence necessarily where, you're more likely to get your paper accepted if you are reviewing for a journal, but it doesn't hurt either. And it also is sort of, it's giving back in a sense. So you're contributing to the journal that has been helping you maintain your productivity as well. And yeah, I'm just looking back at the question on the uh, agenda to make sure I didn't miss anything. But yeah, I think those are sort of the main ways that I evaluate whether or not. I will say the number of requests that I get have dramatically increased within the last year and a half, I would say. So I have become more selective. And I'm also, when I say selective, I'm more referring to the content area. So making sure that I'm only selecting and agreeing to review for articles that, based on the abstract, I think I can give a thorough but quick turnaround. Those are the big, so I free up more of my time to accept other invitations.
Thank you for that thoughtful answer. And I'm just kind of just sharing notes in the chat as we go through for folks to kind of keep in mind. And so, Dr. Oki, I just wanted to pass the question on to you. Would love to hear more about the types of journals you've served on as a member of the editorial board and as a reviewer, how you selected them, if they were inside the public health arena only, and just kind of the differences and similarities across the journals you've worked with.
Talking to me, right?
Yes.
So, I'm more on the reviewer side and not editorial. So I'm more on the reviewer side. So I get to publish with journals that, because I'm from LMIC, right? So sometimes the university you're publishing with may not have funding. So you're looking for journals that may have like maybe APC free. So there are lots of reasons to pick a journal. So you look good because the impact factor is high, the APC free. Then you look at, we don't have so much money for the research and all this. So that kind of influence, and that's the part of global health equity, right? So I need just to put that there because we still have that, limited, resources for research and publication in Africa and even other global south, countries and all that. So yeah, and because I get to publish with those kind of journals, I get invited as well to review. So I don't know if you noticed, most time when you get to publish the journal often, before you know it, they start reaching out to you. Do you want to review this? Do you want to review that? Especially in the areas where you're publishing. So let's say you publish something in digital health, they'll soon reach out to you. Even probably like one or two, they'll reach out to you to be part of the reviewers for any similar research. So that's like I've got to review lots of papers. And what I've realized is that it's for research, right? It's more about the methodology. So most of the challenges I've seen in the work I've reviewed is either not documenting properly, not including everything they need to include, just assuming that the reviewer would know this, know that, and then you now have to ask a lot of questions as a reviewer. So I believe if you get your methodology right, most of the time you shouldn't have so much problem that on the research side. And then on the opinion articles, op-ed side, not just publications, peer review, right? We have other kind of publications because I know BCPH kind of have that overarching view into publications, not just peer review. There are other kind of writing as well, like storytelling, journalism, thought leadership, stuff like that. So what I've really realized in that is the more you're able to present yourself in a very succinct and in a very straightforward way, and captivating way, the better. So if you're not beating around the bush, you're not using too many words where you can, for example, let's say you can say something with 20 words, now you're using 40 words, it gets more complicated. So the more sharper, the more crisp you are with the way you write, you get to build that, and you reduce the number of rejections you have when you try to publish in that area, when you have a voice and you can just go straight. There's a way you there's a way you read someone's, I know you know this. If you've read a lot, of someone's publication, especially opinion articles, op-ed, thought leadership, you can get their voice. When you read another article on that page and there's no name, like, yeah, I think this sounds like this person because they found their voice. They go straight to the point. They know how to communicate, and that makes it easier because you then have reduced turnaround time on publication. So once that idea comes to your mind, let's say there's something going on in the world, you can easily, even on your Google Doc or something, put things together and straightforward because you have a way you write, you have a style, your own style, the way you do paraphrasing, paragraphing, and everything. So, and then above all is practice. You just have to do it. It's like you just have to keep writing, and before you know it, it gets easier, it gets easier, and the more you write in a particular area, for example, BMC, I get more review requests from BMC because I've published a lot with them. So things become easier once you've made a name for yourself already. So there will be a lot of times that you just get an invite. Oh, we're trying to put up this journal, we're trying to put up this. Do you want to add something to our publication? Do you want to add something to our what do they call it now? So editorials, they'll reach out to you. Oh, you found your work. So you want to build a niche to make things easier on the long run. Thank you.
Thank you. Thank you. And so with that kind of leads us right into our next question about reading submissions. And the first time you come across a submission, what are the three things that you look for? Like what helps you see that this is a publishable work, or maybe it's not quite ready for prime time? And does it vary by a publication's mission and vision? You know, like in our case, we have a very clear mission and vision around looking at health through the lenses of justice and equity. So with that, I think we'll go backwards this time and we'll go to Paul.
So I think really when I'm first looking at an article, I would say the main thing that I'm looking for, and this can be I think it does sort of break down into three elements, but I would just describe it as consistency. So the first is looking to see whether the title is consistent with what's in the body of the manuscript. So are they doing what they said in the title that they were doing? That's like the first level. Then it's consistency between the methods that they describe and then what they actually did. And then finally, it's the results that they're reporting. And does that match actually what's in their tables and figures? And, those I think account for most of the issues that I flag when I'm reviewing a manuscript for the first time. And it sounds simplistic, and in a way it is. But when you think about how so many papers are written these days, where especially if you're working in a research team environment, you you delegate, right? So some person's writing the intro, another person's working on the analyses, they're writing up the results, someone writes the discussion and the conclusion, and that's a good and effective way of writing a paper so that you're not overburdening one person. But when they come together, sure, you give it someone whoever's leading the effort usually gives it the once over and reads through, but it's so easy to miss where things aren't aligning in these particular sections, and those I think become those are sort of the indicators that I look for. They're not fatal flaws usually. They're things that can be easily addressed or corrected. But I mean, I'll just give you an example without being too specific of one that I reviewed recently where, and this is a title results kind of mismatch, where what they described in their title was, this isn't exact, but a close approximation, stigma experiences and COVID vaccine hesitancy. They're like that. This is what I forget what the actual title is, but that was in the title. But then when you go to the body of the manuscript and you read their methodology, you find out that really what they were measuring was anticipated stigma, which is related but distinct in terms of what that relationship is. They weren't actually asking people if they experienced stigma in the context of receiving or seeking COVID vaccines. They were talking about anticipated stigma. And their whole discussion kind of treated it as if they were actually measuring stigma experiences. So that was a mismatch that, again, is amenable to revision, because then you just sort of you change your focus to anticipated stigma and its effects on COVID hesitancy. And that's what they ended up doing. And then I believe it was finally accepted for publication. Marisha, I see. Do you have a question?
Yes, Dr. Devanzo. So to go back to this whole like distinction between anticipated stigma and then no, I'm sorry. Never mind. What I'm trying to get at is what's the best way to curate a title so it reflects what's in the body of the article? Is it like, do you suggest best practices, or is there a way to approach it really, or is it more?
It's a great question, and it's probably the part of paper writing that I struggle the most with. It seems so simple, but I am terrible at coming up with pithy titles. And it's something that you see more and more. And I think this is another source of where mismatch comes into play, is because people who are more attuned to, they treat it as sort of an SEO problem, right? They want a punchy title that people will find, and that'll cause them to click and download the article where they can, reference it. But that's just not how my mind works. So my approach, I don't come up with very creative article titles. It's more just sort of descriptive and accurate. So, if I'm working, I'm thinking of maybe one that I've written recently. If I'm working in a particular geographic area, so a lot of my work recently was in New York City. I'm now living in New Jersey. But when I was living in New York and working in healthcare and academic institutions in New York, working in New York samples, I would be very specific. I would say, among sexual minority men attending a sexual health clinic in northern Manhattan. Like, I think that's a key sort of, if you can fit it in, you want to be specific. But I'm sure there are probably others who have other opinions on this. And again, I recognize that it's not my strong suit coming up with good, pithy titles.
Great. Paul, if it's okay, we'll hop over to let's hop over to Gabriel. He's raised his hand.
Okay,
So.
I mean, I'm not sure if this will be so far helpful for you, but what I would advise is that just as if you're writing a summary or an abstract, you write that at the end of your work. You shouldn't worry so much as well about your title sometimes. Yes, you can put everything in your mind, everything that comes to mind down, just keep jotting. Okay, so when you're writing, because I believe you don't finish writing in 20 minutes. So while you're writing, anything that comes up to your mind as a title, just keep writing them. Because it's always good to give yourself some room, like give yourself some room to think about it more and more, because if you worry too much about the title, you still have a lot of things to write, right? So I advise that you just keep writing, keep getting better at writing, and whatever you're working on at the moment, keep working on it. And then whatever comes to mind as a title, just keep writing down. Because even thesis that we do in universities, right, like dissertation, sometimes you start with a topic and then you end with a different topic. So imagine you keep worrying about the title and then you didn't do your dissertation. So anything that comes to mind, just flow, write it down, document, don't miss it, because you don't also want to now start trying to remember later on. Oh, I got a title before, now I don't have it anymore. So just keep jotting down. And then when you're done, pick the best. What's kind of summarize everything that I've written? The same way you put up an abstract after or an indicative or a summary under your title and then your keywords, the same way your title is. And abstract comes last, right? So you don't want to worry too much. Worry about the substance and everything that comes in. And as you go, just keep putting everything that comes to mind down. That's the way I approach it. Just figure out what works for you as well.
So Gabe, since we're on you, what is something that really jumps out with you when you first reviewing a piece for a journal? What are you mainly looking at?
The title, of course, because I want to tie it to something in my head, so the title and then the keywords. So I want to look at the two first to then start thinking about the work, like what do I need to think about? For example, if the title is about say climate change, I look at the keywords, planetary Earth, then I know I have to pick up my, my reasoning around climate change. Then I have to know, okay, I'm reviewing something in this space. Then I look at the abstract to read a summary, for the research. And if it's um just any kind of other any editorial that is not peer review, I look at like the summary. If there's like a summary, like a cover mail or a cover letter, stuff like that, I just look at them first to kind of understand what the writers have done, to get a glimpse of what they've done overall. Then after that, I look at the methodology because that is where the work is. So if it's a journal, peer review journal, it has to be sound. It has before even going, I have to stress myself about the whole body of work. Let me look at the work. Is it really sound enough to meet the quality that we've set for this journal? So because imagine I keep reading everything and then I realize, oh, this is not even sound. So I kind of look at it, just skim through and be sure this is what giving so much time to. Then after that, then I read through introduction, conclusion as well, because we want to see where. Let me give an example. There's a work that we read that was rejected, I think last week. So the work is about smoking cessation among students. So it's a behavioral study trying to understand what students know about smoking cessation and then make recommendations for their curriculum. So at the end of the work, the writers now suggest that smoking cessation and tobacco harm reduction should be added to the curriculum. And I was not on that paper. It was later on that they brought me, and I have to recommend. Are you sure? I have to like recommend to the editors, like, are you sure you want your journal to represent these, like present that you want something like these in curriculum of medical students? There are other priorities, there are other things. Are you sure? I'm not saying you should reject this work, but be very sure that when this work is published, you won't have to retract it and all. So, I kind of look at conclusion because at the end of the day, the work comes down to what you're recommending, what you're concluding. So I look at that as well to see where to place the work in terms of context. Then to now see, oh, this is suitable for the journal, this is not suitable. And the fact that something I'm reading is not suitable for the journal, that does not mean it's wrong. There are times we refer to another journal within the same, publisher network. So you can publish. So if, for example, your work is good, but we can't publish in this particular journal, we can refer you to another journal to publish with these, and then just send them the link to submit on another journal. So there are different ways to it. So I've mentioned the clarity, I mentioned the methodology, and also as well, because of the kind of papers I review, I look at the author's affiliation and all as well. So for example, if you're writing something about Rwanda and you're like 5 or 6 authors on the paper and you don't have any Rwandan there, then start looking at, for example, let's say you work among people in the communities that are speaking, call Rwandan language, and all of you are from, let's say, Europe, So I start looking at the methodology, like how did you translate your questionnaires, things like that. Start looking at the nuances of, everything they've done. You want to put yourself in the research and say, okay, this is very credible, So those are the things I look at as a reviewer, So yeah.
Great, great. Just in thinking of time, Patrick, like building on that, when you're thinking about all the things that jump out for you in terms of publication and like whether or not how you're going to be assessing it, what are those factors that lead you to marking an article for like revision versus reject?
Yeah, I think it might be helpful if I zoom out a bit and talk about the triaging process before it's even decided. Basically, the decision about whether or not a paper is going to be sent out for a review. Because I think that's the first battle when submitting an article to a journal. And so the kind of way I approach that is, of course, reading the title. And once I read the title, I actually jump to the cover letter. So I want to see why the corresponding authors articulating that they believe the work makes sense for this particular journal. And so for the journal right now where I'm triaging essentially is American Journal of Public Health. And so there's 3 key things that I look for and that I've adopted when I'm shopping my own work around. And the first is an articulation of how the work is responsive to a current public health challenge. I want to see that folks who articulate that early in the cover letter, like within the first paragraph, kind of hook me in. And then it's a matter of how is the work novel? What about it in terms of topic or methods? How's it pushing the envelope forward? And then lastly, kind of what's the so what? What's the implication? How is this relevant for current policy? And then I start to think about, okay, if it's interesting and if it's kind of satisfied those three criteria, then I might spend a little bit kind of just taking a look quickly at the methods to see what's the design that we're working with, what were the types of things that were asked, because we don't publish perceptions work really, kind of thinking more about generalizability or transferability with qual work. And then I actually just jump to the first paragraph of this discussion, because I find that a strong paper that's likely to be favorable to reviewers, that's not going to really burden the reviewers, is one in which the discussion quickly restates kind of the study, the three main findings, and then one sentence about the punch implication, like why this work meets the caliber for publication. And then from there, if I think that that's all been met, then I'll start the process to find reviewers and all of that good stuff. And so reasons for a reject at that stage could include, like I mentioned, kind of work around perceptions, for example. If there is a pretty significant mismatch, sometimes if I'm interested in the topic, I'll recommend to the editor-in-chief that we might ask them to try to fix that minor error. If it's evident that, I've seen it once where someone put the wrong abstract in from a different paper that they were working on, but the paper was good, and things like that. So the other thing I would say too is, aside from just considering if we're going to send a paper out for review, sometimes folks submit work that might be really interested in the topic, but it just isn't right for some other reason. But we might invite them to rework the piece into a different format for the journal, because we publish editorials, we have analytic essays, we have short reports, things of that nature. And so I would say that this is true for other journals too, that the editors, when they're triaging, they're also thinking about, especially if the work is timely and responsive, might there be certain modifications that we would invite them to kind of rework the piece?
That's really interesting feedback and very helpful. We're at about 3:45. I see some hands and I see some questions in the chat. So I think that folks are asking questions that kind of coincide with our planned questions, though. In our last bit of feedback, if our panelists could keep in mind, one thing I would like to hear is, in feedback, how do you balance being constructive, but especially like when a paper is messy and maybe like very triggering to your research methodology or and approach, and also, like, how do you handle disagreements with other reviewers, especially or between reviewers if you're on the editorial board? And I do appreciate all of you have been talking about how to address things that could be fixable. So how do you balance rigor with being constructive? And how do you handle disagreement? And then I think we might want to start there, considering that we'll start with Dr. Sade's question, like, how do you ensure that the suggested manuscript revisions are agreeable with all concerned authors? So, Gabe, do you want to start us off with this?
There's like three questions, so just summarize. So, constructive criticism. So yeah, basically, I mean, a paper cannot be totally wrong. So you look for the positives first, like what have the writers done well, and for the writing to even pass the technical writing stage, like the first plagiarism check and all that means to put in some work. So you look at what the writers have done well and appreciate in terms of feedback to the writers, right? You appreciate what they've done very well, then you start picking it from the biggest concerns, and then you bring it down to the lowest concerns. That's the way I approach it. Then the lowest concern, for example, there are things that that might actually be fixed by just maybe paraphrasing, just phrasing differently, stuff like those I'll put at the end. But I'll start with the major things, like maybe the analysis, maybe the type of study they've put in, the sampling methods, because those are very important to deal with. Then I will just rank and just list down to the list the list of their problems. But yeah, you start with very, very positive for me, just to let them know, yeah, you put in the work, you've passed the technical writing stage. So that's one. And in terms of agreeing or disagreeing with other reviewers, I mean, I don't have much experience with that because I'm on the reviewer side. So editors have more experience in that because now they have to look at other reviewers and then make decisions, final decisions. So I'm like just one vote of this commission review.
Yeah, so I think with that, I didn't know if Paul, or Patrick, if you had anything you wanted to tag on to that.
Pat?
Yeah, just quickly, I would say it's rare when all three reviewers, or even two, but especially three, will agree. And I'm not really, when I'm looking at the reviews, I don't center whether or not folks are going to agree. More often than not, people agree that a paper's great. People agree also that there's a major flaw. I think it's kind of rare for there to be like major discrepancies unless I'm seeing this a lot around AI actually, unless there's folks who are like niche methodologists and then they really truly understand that particular method, and our other two reviewers are more so focused on content, that one reviewer is able to sync an entire paper. And so really it's about like, how do we get this paper to be, if we're interested in it and want to issue a revision request, whether that be minor or major, how do we then best prepare the authors to do the work to try again, essentially to revise the paper, because it's not our job as reviewers or editors to write people's papers for them, but it's about how can we provide, especially from an editorial side, sometimes there is a little bit of smithing, and I will say, like, you can be less concerned with the points that reviewer one made because we might, from an editor's perspective, I'm less concerned about this. I'm really going to need to see you thinking about this particular aspect of the work as it pertains to like, how are you addressing, a limitation with the design or something along those lines. So it's almost like a case by case basis, but I would say I'm not sitting down and looking at the reviews and thinking about how am I going to get folks to agree? Because chances are, if it does go back out for review again, those three authors, maybe I would say at most, it's like one of them will agree to re-review it.
That's so interesting. And I guess I was also thinking, Dr. Sade had an interesting point when you have like the author who is the main point of contact. If there are a lot of revisions done to a manuscript, and so it's been transformed beyond the recognition of contributing authors, how does a reviewer or an editorial board handle that? I didn't know if any of the three of you had experience with that.
Is the question about how the reviewer editorial board handles it, or how the writing team handles it?
I think in terms of the editorial board or the reviewing team might be handling it.
Well, if the manuscript is drastically changing in response to points that the reviewers raise, that's good. If there was a lot of requested revisions or points that the reviewers were asking the authors to take up, in those instances, when you get like a major revision as the disposition for your, let's say, your first submission, you're expecting there to be significant overhaul. And like the examples I was referencing earlier, that might even include the results. There may have been a fundamental problem with the analysis that was amenable to change, and now you have like a brand new table with all brand new numbers, right? So like in those instances, you are looking for things to be significantly different. I interpreted Dr. Sade's question initially as, how do you, if you're lead author on a paper and you're the main point of contact, you're receiving the reviews from the journal, how then do you negotiate with all the other people that were involved in the writing in order to then get their consensus to submit it? And just to answer that question briefly, the short answer is it depends on the writing team, right? some co-author, will be fine with delegating one person to be, okay, you got the revisions back. This is now, you're going to take lead. Send it to us for a quick kind of, we'll read through it and then give it the okay, and then you can resubmit it. But that's just one example. Other teams might work differently.
I just am keeping in time. I saw that Dr. Obina had his hand up a little earlier, and I just didn't know if you wanted to chime in with your question, Obina. Oh, you said you wanted to follow up with the cover letter and how many details in your experience is better. I find myself being very succinct and very specific. And so,
Yeah, I would say
yes.
short and sweet, enough that you can, get the title of the paper in there, and again, kind of addressing those three key elements around responsiveness, novelty, and then implications. The other thing that I would mention, especially for AJPH, but I saw a question in there about health equity, is we also look for an attention to health equity, which it's always been important, but especially important right now. And so sometimes though, that's not implicitly, I don't, it might be odd to kind of write out a sentence specifically about that, but usually the work, it becomes evident through, what did you do? Who did you speak with? Who was involved? How are you kind of writing things up where the health equity lens is apparent?
Gabe, and Paul, did you have anything to add to that?
No, none for me.
Okay, so I guess this moving on. I see. Oh, Masavini, you have your hand up.
Yes, thank you. I just thank you so much for the exciting discussion. I had a question relating to a bit earlier in the conversation. Dr. Oki had mentioned, other being writing non-scientific articles as well, like op-eds doing storytelling. And in my current work, I come across a lot of people, especially with an epidemiological or clinical background, who entirely dismiss like basically not the typical research format, research article format, and anything else that is a bit more creative gets immediately dismissed as non-scientific, not rigorous. And I was wondering, how do you maintain the balance between having scientific rigor but also having some creativity and pushing towards impact? And what the panel's approach is to this.
Okay, I think for me, basically, I write about what I really know a lot about. So that's why it's called most time thought leadership. So, for example, let's have worked over the last 2 years in maternal health in sub-Saharan Africa. Most of the thought leadership and op-ed I write will be around that. So I can easily even, from my head, cite a paper and just go maybe hyperlink, or footnotes, or whatever kind of reference style the journal or the publishing media use. So because that's where I've been over the last few years, kind of know, not like I have authority in terms of entitled, like overall authority, but to an extent, I have some experience on the field. I know what is happening. I've spoken to a lot of people in that area, so I can produce a lot of insight in that regard. So I don't write about things that I don't know so much about, so that I'm not just trying to I'm not just trying to force it. So I'm not just trying to like put something from one paper, put another from one paper, and just doing it like a job. All right, from talk leadership. So this is what I think about health equity in Rwanda. This is what I think about education in this area, because I've been here, I've spoken to a lot of my lecturers, I've done this. So I can now produce a lot of things that are very relatable as well. So because people that read it, so I'll be reading it from the perspective of he's been there, he's been probably doing work in this area. For example, I was in Rwanda, I did a lot of work around there. Now I'm in the UK and I do a lot of, yes, global health as well, but from someone who lives there and then who has passion for Africa, where I come from, so that's the perspective I'm bringing to the table in terms of my thought leadership. So you want to make sure that, yes, you are citing scientific papers, peer reviews, and very reputable, if not peer review journals or publications and all that, very reputable publishing outlets in your op-eds, in your perspective articles, so that you are reputable as well. So that whenever people click the link to try to find reference for whatever you're saying, they can get that. And then when you're very sound as well in your implications, in your inferences, the way you make your positions known, you kind of just become an authority as you grow in that area. So yeah, the public health is big, global health is big, but sometimes based on on the work you do or the work of the person, for example, if you are the reviewer in this case, so the work the person is doing, just like look at the affiliation, look at what they've been doing, and then you say, oh yeah, this is very good. Because if you're not working in an area and you're giving a thought leadership piece, where did you get it? That means you're just sinking some papers together and giving me some thought. So I think that's where it comes from. Thanks.
Yeah, that was great. I think just being mindful of time. I see a question from Dr. Sami Hussein asking about conflicts of interest. Um, if you're on serving on an editorial board and submitting to the same journal, and Dr. Sami, like if you could interrupt me if I'm not interpreting your question properly, and then Paul, you were talking about like if you're a reviewer, that's a good way to help, you know, help make your case for being published in a journal, and vice versa. If you submit to a journal, then you can become a reviewer. And maybe I was just wondering what your thoughts are on that.
Yeah.
Yeah.
Yeah. I tend, I mean, again, these are all sort of case by case, right? My personal opinion is, if I'm on an editorial board for a journal, that there really aren't other good options, I tend to avoid submitting to a journal that I'm on the editorial board for. Not because they're really, when you think of the process though, there aren't many opportunities for there to be a really severe conflict of interest, because let's say it passes the triage process that Patrick was talking about. It still goes to peer review, and that you're still avoiding conflict of interest with the reviewers. Reviewers are asked and expected to identify any potential conflict of interest with the authors if it's an unblinded review, which some journals are. So that's just my personal feelings on the matter. I don't think that there's any real hard and fast rule when it comes to that, unless the journal itself has some policy where they say, they're not accepting submissions from people who either serve on the editorial board or in other sort of like official capacity. And then just really quickly to your other point, Cersei, the idea that you're going to get some sort of kickback for being a reviewer, or it might ease your acceptance to a journal. I don't think that's like ever been explicitly part of the process. But like I said before, it's more of just it is a transactional thing without actually being transactional. You want to help the journal that's helped you. So it's more of kind of like a social contract rather than an official one.
I'll say on the record that our journal doesn't do that, but I do know other journals that are that way.
I know a few that do too. That's why I wasn't, yeah.
So, I won't say them, but and I didn't know if Patrick, Gabe, if you had anything you wanted to add to that.
Yeah, I think what you said is correct, and I absolutely agree. The journals I've worked with, the policy is just always around a reviewer not reviewing their own work. I think that's just the policy, right? As long as you're not reviewing your own work, it's fine. It's not like maybe your name is on the paper and then you're reviewing. So that's like a general rule that they use, and some journals I've worked with as well just use blind review as well. So, but they make sure that even at that you're not reviewing your work. So I think that's just the rule.
I know we're over time, but if just something else occurred to me. A good exception to that though is if a journal is starting to procure articles for a special issue.
Yeah.
Where if you're on the editorial board, you might be asked to write a companion piece that introduces the special issue that So basically what I'm saying is you do still have opportunities like that to contribute writing to a journal where you are sitting, where you are a board member or part of the editorial team. I just didn't want to overlook that exception.
The one just short thing to add, I would say too, is there are some journals that have tried to create reward programs for reviewers. And so one thing that we do at AJPH when I'm inviting editorialists to write about certain accepted papers, one of the factors, and we're open about this as a benefit to reviewing for the journal, is we consider who has invested in the journal and whose perspective would be great to complement an accepted piece. And in making those decisions about who we're ultimately going to invite, we do weight an invitation based off of whether someone has been an all-star reviewer for us. That's a way that we try to incentivize getting yeses from folks who are kind of doing the work to review for the journal.
And it's so wonderful because the way that you've answered that too is really speaks to Mohammed's question in the chat about practical strategies, recruiting, motivating, and retaining like reliable reviewers, kind of looking at past behavior, rewarding those who have been reliable in the past and done really good quality, rigorous reviews. So thank you for that.
Like, play add something, yeah. So another way
yes, please.
Another way we do it is that sometimes when you see an early career researcher who is very good but doesn't have a lot of experience, sometimes there's some journals I've worked with where you have like a youth advisory board first, so they can work with that first and work with more experienced reviewers, so they're paired together. So you can also, after you've published 1, 2, 3 papers, you can join those kind of councils or committees first to get some insight into the inner circle experience of our reviewing work. Some papers are transferred across, to getting feedback, sending feedback. So because that's the barrier of entry to that is quite easy. As long as you're very, very sound technically to write, you get into that easy, very easily. And then you can just work your way up there to become a more experienced reviewer, working with experience. Thank you.
Thank you. Thank you. So I do want to keep in mind we've come up to the end of our time together for today, but I do want to thank our panel for all of their insights. And I want to hand it over to my colleague and also the director of the program if you had any final things to say, as well as our panel.
Yeah, I thought this was phenomenal. Thank you so much. I feel like, this is the second time that we've done this. And I continue to learn awesome things. And every single one of you, Patrick, Paul, Gabe, I'm going to steal some of the things that you said that we don't currently do with BCPHR. And I was like, ooh, okay, well, let's do this. Let's do that. So thank you so much. And thank you to all the fellows. I mean, excellent questions as well. So things that we will also try to incorporate into the next fellowship too, to try and preempt the things that you had. But I'll pass it to you, Sabah.
Yeah, I just want to say thank you to all the panelists. I know we've been busy a lot, especially this period. So it's good to have all of us and the fellows as well. It's really been engaging. And of course, you're coming towards the end of the fellowship. Yeah, it's been a long and short one at the same time, but it's been a good journey so far. So next week, next week Saturday. It's next week Sunday rather. It's going to be the last day for the fellowship. I think it's on the 4th. Yeah, Saturday. Sorry, Saturday. Yeah, it's on the 4th. So we are going to be having our closing meeting. Most of the details will be sent to us just to meet us about that. I know our time is fast spent. But I would like Candice to speak briefly, 30 seconds, to a program that we have, the Ward Delegates. So it's something that we think some of you might be interested in, and it's really cool. And you can have your own thought leadership, just like Gabriel has mentioned, and it's something that any of us can actually do. So Candice?
Yeah, absolutely. So I think some of you have seen me post about this on LinkedIn. So we do have a World Delegates program that started back in February. We have 6 delegates. They have a number of different projects, everything from making a policy manual to doing different podcasts, different types of social media in different areas of public health. So all of you will get expedited invitation. So if you're interested in any of those projects, just email me and I can put you in contact with the exact delegate that you can work with. So that's one opportunity. The other thing is, I know Dr. Sade is a graduate of our Thought Fellowship, but the Thought Fellowship is coming up. Same thing there. If you guys are interested, we can expedite that so you don't have to go through the whole process. And then we can get you started for the interview. April 12th, is that when we're doing it, Sabah?
Yeah.
I think so. Yeah.
All right, thanks everyone. I know it's a lot. We'll send the details via email by tomorrow or today for some of us. So thanks everyone. It's good to have all of us here. I know there might be one or two questions in the chat that we couldn't respond to that will be captured as well and sent via email. So thanks everyone. Do have
Thank you.
Thank you.
Thank you,
Done.
everyone.
You all.